Hello, I'm Dr. Eve. Welcome to the Sexual Health Centre. One of my favourite working experiences is walking into medical school at University of Cape Town and teaching the third year medical students. The young men and women are about 25 years old, and when we start talking about sexuality and sexual medicine, they become very excited and very curious, as they should be, because they are healthcare providers who need to be doing sexuality counselling for their patients in the future. And the men are around 24, 25, and when we begin talking about ejaculation, I can see they become very alert, because without telling me, I'm aware that at that age, learning to delay ejaculation is somewhat challenging for them. This is a reflexive response of most men, where they feel excited, they feel aroused, and they ejaculate very quickly. And it's one of the arts of becoming a man, is learning to identify that feeling of ejaculatory inevitability and holding it back. And it's something that men need to learn on their own, through their own masturbation, and certainly when they are with a partner. Learning to delay is a science and an art where a man must learn this feeling of inevitability. So think about a continuum of 1 to 10 and practice it with yourself as you masturbate. That when you get to a point of build-up and arousal and you're hanging around about a 5 and you feel, I can go a little longer, start delaying, start holding back, so that by the time you get to a 6, you've slowed it all down, even though you're feeling very aroused, and by the time that you're 7, you can really hold it back so that you're not slipping right into the 10 where you've lost complete control. Learn to feel that experience, feel that inevitability, and slow it all down. Translating that to a partner can be challenging because there's a heightened sense of excitement as well as anxiety. And a man has to be able to balance the two scales of inhibition, inhibiting that ejaculation, and the excitement that he naturally feels. You want to be able to slow it down, control the situation, tell your partner what you're needing in terms of fastness or slowness, take a breather, take a break, and if it doesn't work the first time, you want to be able to go back without feeling ashamed the next time and getting your confidence up. One of the biggest problems with early ejaculation is that men begin to feel that they're going to fail. They develop performance anxiety, and that's going to trigger off the ejaculation way quicker than if you can relax into it and understand and accept that sometimes you do ejaculate a little faster. There aren't any drugs on the market to be able to delay ejaculation per se. Please don't use over-the-counter products. Please don't use any numbing products either. Just take your time to be able to learn to delay. If you're a man who has been struggling with early ejaculation your entire life, your lifelong process, please consult a doctor and see what you can get and how much medical help you can get, as well as psychological therapy, to be able to teach you how to have more satisfying sexual experiences. To find out more about early ejaculation and sexual medicine, relationships and sexuality, come to dreve.co.za, find me on Facebook and follow me on Twitter.